a shot in the arm to protect Hoosiers from the COVID-19 virus. But many minority communities don't trust the process. Why? And how are organizations like the Red Cross working to change perceptions about the potentially life-saving vaccine? Well, statistics show that Black and Latinx people are up to 3 times more likely to contract COVID-19, and their outcomes are worse than whites as well. Deaths are also disproportionately higher in communities with larger Black populations. Health leaders are now worried about another trend that centers on COVID-19 vaccines. Business of Health reporter Kylie Valletta has that story. Kylie.
Well, thank you, Gary. Studies are showing that the vast majority of Black and Latinx people don't trust the coronavirus vaccines. In a recent survey, only 14% of Black respondents mostly or completely trust the vaccine, and only 34% of Latinx people. Confidence in the vaccine safety is the #1 predictor of getting vaccinated. So a new coalition in Indiana is gaining steam to help Black and Latinx Hoosiers voice their concerns and grow their trust in the COVID-19 vaccines. Leading the charge is the American Red Cross. Chad Priest is the Chief Executive Officer of the Indiana region. He joins me now, along with Reverend David Greene, Senior Pastor at the Purpose of Life Ministries in Indianapolis. Thank you both for being on the show today.
Thank you.
Thank you.
Pastor Greene, let's start with you. Blacks have the lowest level of trust in the vaccine, only 14%. Give us a little bit of background or context why this mistrust exists.
The mistrust exists because of numerous items that have occurred in the healthcare sector across the country. It starts with the Tuskegee syphilis experiment that took place in Alabama. While the event took place in the Deep South, many of the people living in the North now have their roots in the South. And that experiment is something that is still talked about in African-American homes. And not only do we have those historical events, we also have local events. When you consider the recent death of Dr. Susan Moore, who died of COVID-19 after complaining about racist treatment in the hospital, that also contributes to mistrust. Many African-Americans have concluded you can't trust the system, and it causes African Americans to be hesitant about healthcare as a whole. It's viewed as something to be avoided and not necessarily truly a place where it's applicable and will help all people.
Okay, all right. So Chad, the American Red Cross is really leading an effort to try to make Black people more accepting, also Latinx, of the vaccine. Explain what your goals are for the coalition, what you're doing.
Yeah, thanks, Kylie. So the Red Cross alleviates suffering in lots of ways, but we primarily do it in partnership with all the other human service agencies in central Indiana and actually throughout the state. So what we've done is leverage the expertise of these agencies, who are really experts in communities, to join us, not to encourage people, hey, you must go get vaccinated, but to engage in dialogue about the vaccine. We've got great evidence to suggest that when people have a chance to talk about how they are perceiving the vaccine, their intent to vaccinate, the likelihood of eventually vaccinating actually goes up. So we're looking to amplify the public health messaging around the vaccine, but do it in a way that really generates conversation at the local level. And we're doing that through all of these partners.
And you mentioned one thing off camera that I thought was really important. You said part of this is you have to honor their hesitancy. I thought that was very interesting and a good point as well.
That's right. It is not unreasonable to be hesitant and think through a process of getting vaccinated. We support people in their decision-making process, and that's the key, ultimately, to increase acceptance.
Okay, Pastor Greene, trust is such a big part of this effort, and hearing from voices that these communities trust. So explain just that importance of building that trust and actually just speaking to these people, voices that they already trust. And then also, what are you hearing back from the community so far as acceptance? Is it changing at all?
Well, trust is huge. The COVID-19 vaccine cannot be seen as a transaction only. It's critical that organizations in the city, such as the Red Cross, who's taken the lead, see this as an opportunity, as a bridge to relationship building. And that's what Chad is attempting to do, build relationships in the African-American community, and that will begin to build trust. This relationship must extend beyond COVID-19 and look at many of the health disparities that exist in the African-American community. I'm hearing that, and clearly believe this, that most African Americans know that one day they have to take the vaccine because they value the importance of family and coming back together. They will take the vaccine, but they need to be made comfortable that they can take the vaccine without any unannounced side effects. And so they need to see leadership. They need to be hearing and confirming that this vaccine is a safe vaccine to take.
All right, and you're really focusing in on 3 areas, the Martindale, Brightwood area on Indy's west side, the Etna neighborhood, and Gary, Brownstown in southern Indiana. Chad, only a few seconds left. Just tell us quickly what you've done so far for this coalition.
Well, the coalition is convening conversations in these communities. So both in Etna, Indianapolis, and in Brownstown, we're going to leverage those conversations for a public-facing campaign. But again, it all comes down to dialogue. And the Red Cross role really is just to bring people to the table, empower them to have the discussions. And as Reverend Greene said, really talk about long-term relationships in these communities, which is the key to ensuring community resilience.
And you mentioned you'll be starting in these 3 areas, but you really expect this to sort of trickle down through the entire state, correct?
That's certainly our hope. Your Red Cross works all over the state. Many of our partner agencies do as well. And we want all people to be able to benefit from the conversations and dialogue that are occurring.
All right. Well, Chad, Pastor Greene, thank you both for being on the show today, and good luck with the coalition.
Thank you.
Thank you for having us.
Very good. Gary, back to you.